Hello! This is a video about physical assessment. However, this is not a video about how to do your physical assessment one by one because we already learned about those concepts back in fundamentals. These are just tips of small details you might miss during a physical assessment. Especially if your clinical instructor is right just next to you. So, I hope this video helps. And remember, nursing is fun!
Hello, sir.
Hi.
Hi, my name is Ben. I'll be your nurse for today. How are you feeling right now?
I'm okay.
Alright, so I'm just gonna do a quick assessment on you. Is that okay?
Sure.
Alright. Let me raise your bed a little bit.
What is he doing? He's providing privacy. Now, I know this is such a simple task. However, most students forget about this. So when you're doing your competency, don't forget to provide privacy. Again, another simple task, washing your hands. We're talking about infection control here. So, before coming in contact with your patients, don't forget to wash your hands.
What is your name, sir?
My name is Don Catalan.
And when's your date of birth?
It's 7/26/88.
Good. And can you tell me the date today?
It is 10/15/2014.
And where do you think you are right now?
I'm at Cypress Hospital.
Good. And what brought you here in the hospital?
Well, they said I have sepsis and that my counts are low.
Oh, alright.
Alright, he just did a neurological assessment on me. Now, depending on your patient's condition, this is part of your assessment wherein you can omit. If your patient is conversing with you and is responding with you well, then that will give you an idea that your patient is oriented. However, in my condition, since I have sepsis and that my level of consciousness can be changed depending on the progression of my disease, neurological assessment is vital here. However, if your patient does not have any neurological disorder and your patient is conversing with you well, you can omit those silly questions. That will tell you that your patient is oriented. Just something to remember.
Alright, let me go check your IV side, okay?
As you can see, he is wearing gloves. Don't forget to wear your gloves when you're checking your patient's IV. One of the most common complications is infection. So, you're not only protecting yourself when you're wearing gloves, but you're also protecting the patient.
Alright, no redness or inflammation, so that's good. So your IV line is going, everything's running well. Your oxygen is connected to an O2 source.
As you can see, he just checked my IV. He traced my tubing towards the LRS pump. He's making sure that everything is running. At the same time, he's checking my nasal cannula. He's making sure that it is connected to an oxygen source. These are just few examples of your safety equipment. Most students forget about this. They just know that their patient has an IV site and a nasal cannula, but they tend to forget to look at where those equipment are connected. So safety equipment, it is a very vital assessment to do.
Okay. Open your mouth. Very good. Alright, I see that you have an oxygen, so I'm just gonna go ahead and check the back of your ear, okay?
So if your patient has a nasal cannula for oxygen, you want to make sure that you check the back of their ears and their nose because sometimes those are area for skin breakdown. And while we're talking about skin breakdown, just a key point to remember, don't forget to check their elbows and their heels because those areas are also vulnerable for skin breakdown. So skin assessment, very important.
Okay. Alright, I'm just gonna check your respiratory. Do you have any difficulty breathing, sir?
A little bit.
A little bit? Alright. Inhale, exhale, inhale, exhale, inhale, exhale, and inhale, exhale.
Alright, so he just checked for my anterior lung sounds. And since he's in this area of assessment, you can also check the apical pulse because you're already here. So the apical pulse is one of the most important assessment you need to do.
Okay. Can you lean forward, sir? Because I'm gonna check your posterior lungs.
Okay.
Inhale, exhale, inhale, exhale, inhale, exhale. One more time. Inhale, exhale.
Okay, so when you're checking for your lung sounds, just make sure check it anteriorly and posteriorly so that you will have a baseline of their respiratory status.
All right, sir. Go ahead and lay on your back. Checking your abdomen. It's okay. So listen to your bowel sounds. When was the last time you had a bowel movement, sir?
This morning.
This morning. And how was it? Was it regular or was it diarrhea?
I think it was just my regular.
And is there blood in your stool?
No.
Good. And do you usually, at a regular basis, do you go every day or when do you usually?
Every day.
All right. Good. Does this hurt?
No. Alright, so abdominal assessment. We were taught in fundamentals that you do auscultation first before palpation. However, because of students' anxiety, just because their teacher is there, sometimes students interchange the two. They palpate first and then they auscultate. So just a key point to remember, when you do your abdominal assessment, you auscultate and then you palpate.
No pain here, sir?
No.
All right. Good. Check your pulse. Strong pulses. Grip my hands, sir. Good. Very good. All right. I'm gonna check your elbows. Nothing there. Elbows, a little scar, but nothing there. Okay. Do you have any problem voiding?
No.
No problem voiding. Any
No.
pain when you go?
No, not really.
And are you able to tell when you're gonna go, or do you
Yes.
just go? All right, good. Let me just check your bladder. Nothing there. I'm gonna check your lower extremity. Okay, sir?
Okay.
Toot.
Just a key point to remember when if your patient have SCD and you're going to do your extremity assessment, don't forget to turn it off. Just a key point to remember.
No skin breakdown. All right. No redness or swelling, so that's good. Check the other leg. No redness, no swelling, no blisters, so that's good. All right. Let me go ahead and check your heels. They're intact. Your other heel, they're intact. All right. Pulses. Strong pedal pulses, so that's good. Can you wiggle your toes for me, sir?
Sure.
Okay. All right. All right.
Toot. And of course, you turn off the SCD earlier. Don't forget to turn it on.
All right, sir. Now I need to check your back. I'm gonna check whether there's any skin breakdown in your buttocks or you have any sacral edema. Okay?
Okay.
Turn towards the side for me, sir.
All right.
Back is intact. Sacral is intact. No edema or anything. Everything's good.
One of your key assessment is checking your patient's back. You're looking for any skin breakdown in the coccyx area or you're looking for sacral edema. Now, this is part of your competency that you can omit. But I'm not saying that you're going to omit this when you're doing your physical assessment in the morning. I'm just saying that if you already did this assessment in the morning, when you do your competency with your instructor during that day, you can actually tell your instructor, you know what, my patient is in pain and I'm not really comfortable turning her, but this morning I was able to check her back and they were fine. Or if you noted any abnormalities, then you can tell your instructor. So again, some of the competencies can be, or some of the physical assessment can be omitted depending on your patient's condition. But do not omit this during your morning assessment. One of the most essential assessment that you can do.
Alright, everything looks great, sir. Do you have any questions for me?
No, not really. I'm just having difficulty breathing. That's all.
Alright, are you in pain right now though?
No.
No pain? Alright, good. So here's what I'll do. I'm gonna go ahead and check the chart, see and look if you have any orders for a breathing treatment.
Okay.
If there is a breathing treatment, then I'll give it to you. If there's none, then I'm gonna call the doctor and maybe the doctor can order a breathing treatment for you, okay? I'm gonna review the chart, see what the doctor has planned for you for today.
Okay.
Alright, so here's your call button.
Mm-hmm.
Press that button if you need anything.
Mm-hmm.
Okay. And that's it. I will see you in a bit. Okay, sir?
Sure. Thank you very much, Ben.
You are welcome. Performing a physical assessment is always a nerve-wracking experience.
But you have to remember, your clinical instructors, they're not there to fail you, but they're there to help you succeed.
So go out there and nail that assessment.